Hey everyone, this is Karen from Pros for MPs. Today on Highlighting the MP, I am with adult Gero and psychiatric nurse practitioner Aasta Knox, who just opened her first telehealth psychiatric practice on April 1st. So today she's just going to tell us about her experience working as a psych MP and starting her own telehealth psychiatric practice. Welcome, Asta. Thank you for joining us today.
Thank you, Karen. Thank you so much for having me. I appreciate it.
Thank you. All right, so let's get started. How long have you been a psychiatric nurse practitioner?
I've been a psychiatric nurse practitioner for almost a year now, but I've been working in psychiatry for several years.
And what's been your experience like working in psychiatry?
So, as you said earlier, I'm dual certified. So, transitioning from working on the medical side to the psychiatric side has been a journey. And so, as I was, working on the medical side, working with patients in primary practice, in surgery, and critical care, there was always this psychiatric piece to patients that, you don't always get a chance to address. And just moving through that and being able to care for patients and being interested in not just taking care of what's going on with the body, but what's also going on with the mind, just seeing that I was just attracted to that. And I knew that at some point I was going to transition in my practice habit, and psychiatry just became more and more interesting to me. Mhm. So I started taking roles where I could learn a little bit more about psychiatry and deal with those patients before I finally decided, you know what, this is where I want to be, and I need the secondary education to get there. And that's when I started pursuing, secondary education.
I know psych is just awesome.
It is.
Where did you work as a psych MP?
I worked at various outpatient clinics. And I also did a stint in Geropsych, where I was able to round on patients in long term care facilities. I did that as well. In fact, that was one of my very first psychiatric roles.
Okay, nice.
Mhm.
And then what made you want to start your own telehealth psych practice?
Because I envisioned the type of care that I wanted to provide for my patients. And in this COVID pandemic situation, it kind of changed the way that we provide care for patients. And I kind of got attracted to that, like, trying to come up with these different savvy ways to, get care to patients. That what kind of got me thinking. And it just made me think, the way that we used to take care of patients, doesn't always work. It's just, it's not reachable for some patients. So I decided, I want to provide care for patients, but I want to provide care for patients on my terms, the way I've learned to provide care for patients. And I knew that I couldn't do that in some of the settings in which I'd worked before in the past. I knew that I had to create that environment. I had to create that role for myself and that care space. And that's why peace came about.
Yeah, being a nurse entrepreneur has so much pros, just
Mhm.
picking your own hours, setting your role. It's the best feeling ever.
Yes, it is. It is. Absolutely.
So what were the steps you achieved in starting your own telehealth psychiatric practice?
The steps that I had to undertake, is that what you mean? The steps that I had to undertake to get to the
Mhm.
role? Well, the biggest piece is envisioning, where's your practice going to be? What is it going to look like? What kind of patients are you going to take care of? How are you going to attract those patients? So I started doing the mental gymnastics on that piece, and then envisioning, where is it going to be? How am I going to do this? And taking the steps to figure out how actually to form the business, because you're not going to be anywhere until you figure out how to form it and how it gets formed. You can't do anything until that happens. And so I had to learn, and I had to learn on the fly how to put those pieces in place, how to make, how to form, actually physically form the business. And then it just kind of snowballed, it just kind of snowballed and transitioned into, and every day and every week it was just growing and changing into what I needed it to be.
Can you just elaborate, just to like the audience of like what were the few things you did when you were starting Peace?
The first thing I had to do was find out from other people that formed their own businesses, what are the actual steps, in terms of, how do I, apply for a business license, and what is the state? I live in Illinois. So what is the Illinois Nursing Board? What do they dictate? What do they dictate? Because it's different from state to state, I imagine. And so what are those requirements? Malpractice, licensure, credentialing, credentialing for different insurances, and, billing, who's going to do the billing. So just every day I had to work on those little pieces, even fax numbers, business lines, those kinds of things. So all those little pieces, it's like, oh, wait a minute, I need checks. I need prescription pads. So every day it was just like, okay, I have to put this piece in place and this piece in place. And it took a while. It took several months to get that together.
Thank you for sharing. What is the name of your practice?
The name of my practice is Peace Psychiatric Services, PLLC.
And what came up with that name?
So I was just sitting here and I was just envisioning, what do I want to provide? What do I want to call this? What does this practice mean to me? And how do I demonstrate that in the name? And what kind of patients do I want to attract? And what do I want to see my patients, if they see the name of my business, how do they feel about that? And what will make them want to come and be a part of Peace and be a part of the practice and be a patient? So I'm just sitting here and I was just in prayer and just thinking and meditating, and the word peace just popped into my head, and that was it. I said, that's it. That's the name, Peace. And that's what I went with.
Yeah, peace you can never buy peace. Just
absolutely. We all need a little peace.
We all need a little bit of peace, financial peace, professional peace, personal peace. So that's beautiful. That's beautiful. How are you marketing your practice?
So far, marketing is the big piece. It can either make or break you. And I learned some things with marketing, fell for some pitfalls, Google, Yelp, fell for those pitfalls. Wasn't very successful in that. Facebook as well. Wasn't very successful with those pieces. However, how I market Peace, the best way that I'm marketing is through word of mouth and through the collaborations that I have with other either colleagues or businesses, hospitals, therapy groups, physician practices, substance abuse practices. I get patients that way. And then interestingly, I get patients from patients. So patients will also refer your family members or their buddies. So that's a one big piece to marketing. One of the things that I use is Psychology Today. That is an online platform that allows me to also, I get patients from Psychology Today as well. So I have a site there. I have a, profile there, and patients can find Peace through Psychology Today as well.
Yeah, this easiest thing you could do is just connect and network with, people, different therapists, primary care offices, bariatric surgeons, schools, universities.
I also have an admin who is also doing some marketing stuff for me too. She's hitting the neighborhoods and she presents Peace to different places. I've been sending her to substance abuse places, homeless shelters. She's gone to a couple of homeless shelters, some nursing homes as well, and medical offices as well. So she's
that's awesome.
Yeah. Mm-hmm.
That's awesome.
Quite a bit, she is.
And how much was the startup cost in opening your practice?
So the startup cost roughly between $4,000 and $5,000, and that $4,000 and $5,000 is just some of the things that you're going to need for the business, whether it's hardware, computers, printers, those kinds of things that you don't even think about, prescription pads. And then of course the formation of the business, those costs as well, hiring an attorney, hiring an accountant. I forgot about my accountant. And, different things that you may need, small things, business cards, a marketing piece, ink cartridges, just all kinds of things that you don't think about that you're going to need to start your business. So about between $4,000 and $5,000 to start up. Mm-hmm.
Thank you for that information. And how is your business going?
She grows every day. So we open doors April 1st. And the first month was a little rough because it was like, okay, where am I going to get patients? How are patients going to find me? But as time has gone on, and I used to just stay by my phone, like, okay, someone's going to call, and they're going to need to book an appointment. But as time has gone on, I noticed I don't have to sit by the phone so much anymore because the patients are coming. So every single day I get a referral every day. So peace
That's
is,
awesome.
yeah, I think so, and it's a blessing, and she's growing every day. Every week, I can see a change. I really can.
That's amazing. What are the pros and cons of having a telehealth psychiatric practice?
The pros are you get to practice in the way that you envision. You do. And it's on your terms, how you want it, whatever you want your business to look like, how you want your practice to look like, you dictate that. That is the absolute pro. And by doing that, you can work in an environment that is awesome for you, that is productive for you, that's what you need, whatever you envision and how you institute that. That is the pros, definitely. That's the pros. The cons are it never turns off. Peace never shuts. Her doors, it may be nighttime, but her doors don't shut. So it's work 24/7. You are responsible 24/7. You don't punch out or clock out. That's the con. You go on vacation, your business goes with you. Unless you have someone set up that can watch your business while you go. But do you really have someone else to watch your business while you go? It's still playing in the background like an app. So that's one of the cons about having your own private practice. You
Yeah,
always have to manage it. Mhm.
that's true. Even on vacation,
And on vacation. Mhm.
good to know. And then what advice would you give to the nurse practitioner who wants to open up their own telehealth psychiatric practice?
I would say, so when my approach to creating peace, I was a little impulsive and I would just really wanted to get the ball rolling and just get going because I was ready to go. But I can't say enough. Do your research beforehand so that you have all those pieces in place before you start implementing stuff. So you don't make mistakes and have to undo those mistakes. Do your research, find out the things that you need to start your business, and even collaborate with other people that are already in practice so you can see what their practice looks like and the steps that they took to put that practice together. So you know what your responsibilities are, what your opening costs are, and what you need to do, how much energy, the energy that you need to spend to even put that business together, what that's going to look like for you. I would say do your research first. I didn't
Yeah,
do that much, so yeah.
yeah,
Mhm.
you definitely want to talk to people who have started their practice, ask them about their strengths and their weaknesses just so that you don't repeat the mistakes they did.
Absolutely, absolutely. Mhm.
And then my last question is, what do you see for peace in 5 years?
I see peace growing by leaps and bounds. I do. I envision maybe hiring another provider at some point. Not now, because I like being a solo flyer for right now, but maybe in a year or two, maybe bringing on another nurse practitioner. However, I am going to bring on a therapist before that time. So that's the next person that I'm going to hire and just see where it goes. At some point, as I'm approaching my retirement age, I see myself kind of moving back into the periphery and just, letting peace grow and let other people help with that growth. But for right now, just see what direction she goes in.
That's beautiful. Beautiful 5-year plan, 5-year goals.
Thank
Um,
you.
thank you so much, Aasta, for joining us today. It was a pleasure talking to you.
Thank you, Karen. Likewise, I appreciate that.
Thank you.